So, good morning, everyone, dear colleagues. Nice to meet you. So, very first, I have to say thank you for the invitation and to be a part of this great event. Yeah. So, I'm pretty sure that you already heard great lectures all the day yesterday and some very good hands-on also this afternoon. What we are going to talk about for the next 20 minutes going to be about the perfect bone. Especially, I want to talk with you about how we can improve the predictability of our implants and our augmentation, especially in perio patients. So, why is it special maybe to treat perio patients? Because the perio patient itself has a certain risk factor. And you all know it from your daily business that mostly the perio patients are also correlated with other risk factors like smoking or like diabetes. So when we do our surgeries, we are always at a medium or even at a higher risk level. So you need to have techniques to make sure that you have very good outcome also if you have the risk factors. So I want to start my lecture with this kind of patient case. And the question, why is it so special to treat perio patients with implants and augmentations? This patient came to our office, to our practice, and he said, okay, doctor, can you please help me? Some of my teeth are quite loose. I want to remove them and want to place immediate implants. I said, okay, we have to check everything. Now you have a risk factor, you have a periodontal disease, you are smoking. Maybe this is not the right solution for you. He said, oh, I know it already. I already got some implants, and the doctor, he just put the tooth out and put the implant in, and everything worked very well. I told him, okay, in your kind of situation, we can't do this with you. So we told him our treatment plan. It was way too complicated, way too long for him. He said, okay, thank you very much. What was the end of the story? He went abroad. After 2 years, he came again. This was the situation. You can see some teeth were gone and some implants came. But what occurs as well? You can see here, yeah, we have a periimplantitis defect. And also at the contralateral side, you can see we have a horizontal defect and also, of course, the periimplantitis because the patient, he didn't change. Yeah? He is the same. Yeah? He's smoking. He's not following the instruction of the periodontal therapy. So this is the situation we are confronted. Yeah. So this is what you keep in mind even after a very short time, after 2 years. Yeah. So, and I know it by myself, 2 years are going like this. Yeah. My daughter now, she's 17 months actually, and the time is running by actually. Yeah. So here you really have to be aware of that even after this very short time, the defects can increase very high. So I told you now maybe the problems, but when we are asking ourselves the question, what then really do we need to consider, yeah, to get a very good outcome and a success, even if we are treat the patients with a higher risk level. So now I'm a clinician about, I would say, 10 years, and I had the possibilities and also the great honor to do a lot of hospitations in Germany, in Europe. I had also a good friend in Michigan. I was able to join him to see different type of implant systems and augmentation concepts and also perio treatment. So, and I said, okay, for young colleagues especially, it's not really easy to find the right way because you have so much events, you really don't know which type of implant do I'm using, which type of implant design is the right for me, maybe for the patient, which augmentation material should I use, yeah, which type of soft tissue contouring or surgeries can I really do in my daily business, and of course what is necessary to think about it, what is the restoration about. Yeah. So for me, a very good concept is you have to think about these four parts. Yeah. You have to build the right bone vital and very good bone, then you have to consider which type of implant design. I'm not talking about the companies, of course, but the design is very important and there are big differences. Then the perfect pink, it's all about soft tissue managing. And as I said, the perfect white, it's all about the restoration. And if you're considering these 4 points in your practice, then you will have success. So, but now let's talk about the first point, the perfect bone. And I think this is actually normally a key word. I think you heard it a lot of times yesterday and also today. Maybe what we do is we usually use it with porcine biomaterial. We mix it with hyaluronic acid. And as I can see you at the next page, I show you what collision membrane we are using. You see, I'm nearly 100% a clinician. I have a lot of colleagues. They are doing the research and the papers. We try to adapt it in our daily business, in our practice. But these are 2 very, very good papers. If you want to read them later, you can scan the QR code and then you can read it. So this is a defect, what it looks like when we are do it in our practice. You can see sometimes we also use some tent pole technique, yeah, some osteosynthesis screws to even increase the graft stability. So graft stability is also a very, very important keyword to keep in mind, because there's a very interesting paper from a good friend of mine, Frederick Kaufmann. He talked yesterday. And he did a research that if you do the buccal augmentation at the lower jaw, and if you just do the wound closure and you don't use the sticky bone, you have up to 42% of shrinking of the biomaterial in the crestal area. So this is the problem. If you are not keeping an eye on the graft stability, I did it by myself a couple of years ago. Yeah, so we did the drilling. Yeah, we had some bone. We put it on the outside. We did the wound closure, and we thought, okay, there will be bone. But if you be honest with you, if you do the re-entry, there will be no bone. Yeah, so this is the problem. Yeah, because there is no graft stability. Yeah, and so mostly we processing here the sticky bone, like Stefan Fickel yesterday showed us. We have our bone material. We put some drops of saline solution inside so that the hyaluronic acid can fluid more into the bone graft material. And then, as you said, Bashar, yesterday, thanks for great lecture again, you using 25% of hyaluronic acid and up to 75% of bone graft material. Yeah. So even, of course, if you are doing some scraping or doing some drilling and we have good bone from the patient, we also, of course, mix it. What you have to think about is that the graft stability, so we also have some lectures where we compare blood concentrates versus hyaluronic acid. And here you have to be honest that the sticky bone, if you're using the blood concentrates, getting a little bit harder, very, very sticky. Yeah. So here it's not as that hard, but in my opinion, if you use maybe some tent pole technique, then you can also do very, very good grafting. And here you can see in normal cases, we're using here a resorbable native collision membrane, like the Smart Brain you see here at this symposium, some pins and some osteosynthesis screws. And then I want to show you a case. Unfortunately, we had to remove the teeth. It was a perio patient combined with a smoking habit. And here you can see a good friend of mine, Frederick, he always says, Alex, I like your augmentation cases. It's really nice. But when I have a look at your vertical incision technique, it drives me crazy. And I said, okay, it's hard for me to say, but Frederick, you are right. Yeah. In this situation, my technique, my incision is not perfect. Yeah. You can see, to be honest, my focus here was at the posterior area. I was focusing on the sinus lift. And then I said, okay, I also want to build bone here in the premolar area. But then we see a couple of months later, you can see it's a success. So, and this showed me that if you have the right augmentation concept, it even compensates some failures that, of course, occurs. If we talk with Frederick, he doesn't make mistakes, yeah, but I'm a human being. So here you can see in the daily business, it's very easy, yeah, to use here an augmentation concept, even if you have maybe some points, maybe the patient is not compliant, yeah, even here if you have a high risk level and the outcome is very good. Yeah. So I want now to jump in some clinical cases with you. And this is maybe a case where you say, okay, I think the regenerated bone is maybe is not so complicated. Yeah, this patient we had to remove the tooth. The patient she already suffered from a periapical lesion. She also had a root resection in this area, but the pain was still there. So we had to remove the tooth, and actually you say, okay, to rebuild this bone, maybe it's not quite complicated, because even if it looks very big at the buccal side, you always have here on every side, you have the own bone of the patient. So you have a very good graft stability because of the defect. So, but what makes this case so special? You can see here our technique, it's always the same, but the patient was not compliant. She was not a perio patient, but she was a smoker. And she said, okay, I didn't know that I was not allowed to chew on this side. So he was chewing on our augmentation. So we had here a very failure in the very beginning. And to be honest with you, this time, this situation occurs 2 times. Yeah. So we had, I think, about 2 or 3 weeks till the soft tissue was nearly closed. Yeah, because we had really some problems with the wound healing in this area. So you can see we did some new sutures. We adapted our hyaluronic acid in this situation. And then after a couple of months, especially, it depends of the defect, we wait from 4 months to 6 months. Actually, if we do the re-entry in this kind of situation, then you can see that we have quite nice bone. We were able here to install the implant in the right position. This is also maybe a link to the perfect screw. If we have risk patients like perio patients, I'm a big fan of this type of implant. This is a Tomin implant because, of course, the Tomin implant, because here the surface is amazing, yeah, and I'm a big fan of the polished shoulder. Here you have some different heights. You have 0.5 till up to 2.5, and here you have really good. It's like the tissue level, yeah, but you don't have this wide area. So here you also and your dental technicians has more possibilities to create a very good crown. And what we also always try to make the best out of the situation. Here you can see we proceeded a little roll flap to the buccal side. I'm a big fan of the double sling suture. For me, it's very easy and very good suture because it will be able to close the wound in different areas. Yeah. So we actually do the double sling suture. Then we normally use a horizontal mattress suture and then just normal one sling suture. And then you can see here we always adapting, even if the situation and the surgery lasts a little bit longer, we always using the hyaluronic acid also between each step to improve the healing process. And then you can see after 7 to 10 days, you have very good soft tissue conditions. And also, even if we used in this kind of area, I would say a standard healing abutment, you have here the height and also the perfect width of the soft tissue conditions. As you can see, my mentor Stefan Fickel, he always says, okay, the bone stands hard, but the soft tissue is the guard. So, and maybe you know also the bone sets the tone, but the tissue is the issue. So it doesn't depend how you say it. Yeah, you have to have an eye on the soft tissue conditions. Yeah, if you want to have success for the next 10 or 20 years. And then as I said before, also the crown and the restoration is really, really important. And then you can see here that even if you go delayed, you can really create a nice soft tissue conditions around your implants and to save your rebuilt bone. The next case I want to share with you is also an interesting case because it's a combined case. We have here on the lateral side a perio defect, and here you see we wanted to place some implants. The patient, she was not really happy because she got pain on the weekend and she had to go to the dentist. And as you are all clinicians, I'm guessing, you see I don't really like when other colleagues treat my patients because you don't know how they extract the tooth, you don't know how they proceeded, how they cleaned it. So I'm a big fan, and I try really to skip cases like this. Yeah, but the situation was, here this is the reason why the X-ray is not of me, because the colleague, he extracted the tooth on the weekend. Of course, you can say, yeah, they are one hopeless tooth maybe, but now we had to deal with this situation. You can see on the left side or on the right picture, you have deep probing depths, and also the X-ray is of course compared to this. You can see here like a horizontal defect, and here on the left side we had a very, very big defect. If you have in your background that we always treat the patients in a higher risk level, like perio or smoking, we treat this patient a little bit laid back. If the patient says, okay, I want to do the fast track way, I'm not the right one in kind of this situation. Yeah. So what we did here, we did a sinus lift, and then we tried or rebuild the buccal bone and also the vertical bone. Of course, I have to be honest with you. The technique I'm using, you have the limitations, because in most of the cases we use a resorbable membrane, and of course, because of the pressure of the soft tissue, you maybe need some plates or some meshes, to even increase the graft stability. But when you see here the dimension of the defect and then a very, I would say, simple technique, sometimes I even don't use pins at the palatal or lingual side, because I just flip the membrane under the soft tissue, and it is really, really compact. And then on the other side, we did the scaling and root planning. We did the cleaning. Actually, in this type of case, I didn't use the Perisolve. Now we are using it in a lot of situation. Yeah, even in, of course, in if we're doing not the clean and seal, if we do the open flap debridement, you can of course also use it to do also a chemical decontamination of the surface of the tooth. And then we did the suture, the X-ray, and this was the follow-up. Of course, we have a recession, to be honest. Yeah, the probing depths are quite okay. The patient at the beginning maybe had some problems with the hypersensitivity, but this picture also shows you what we are confronted with. You always have a post-operative shrinking, and you can't really say how big it will end up. So of course, at the posterior area, maybe it's also good because you also have a limitation of your probing depths, but in the aesthetic area, you have to think about this, because this in the aesthetic zone could be a failure. In this situation for the patient, she is fine with that. On the left side, you can see where we came from. And this is the situation where we, after placing our implants. You can see even if we have here some limitations, of course, with this very easy technique, we were able to place the implants in the right position. And then you can see here the X-ray in combination with the sinus lift, we were able to have very good distances. So we rebuilt the bone. We place the right implant design and implant system in this kind of area and this kind of patient. So all implants you see in here are the Tomin implants, actually. And here now you can see, okay, we have to think about pink. Yeah, so we have to think about the soft tissue conditions. In this area, we see that we have here a lack of volume in this area. So what can we do now? Of course, we can do a free gingival graft, but we try in our daily business to do as less as possible. So what we did now, we did the incision and we tried to put and bring the good soft tissue conditions to the buccal side. And I'm a big fan now of the individual healing abutments. This type of individual healing abutment, you can adapt some composite and you can reduce it so that you can really make it perfect for your patient. And the right picture, you see, it looks a little bit awkward, but here I want to show you, even if you just place this individual healing abutment for maybe 3 to 4 minutes, you can see the adaptation of the soft tissue conditions around this area. And you can see we always use also in between the hyaluronic acid to regenerate and to stimulate the wound healing effect. Here on the right side, you can see also that we don't really use to close the wound 100%, even here to maximize the keratinized mucosa in the total white. Then you can see the follow-up after 10 days. And here you also always have to be sure about that if you're doing soft tissue surgeries around implants, that the tissue is different than if you treat a tooth. Yeah, and here you can also see that it just takes a little bit longer, even if you are thinking of that we are at a risk patient. Here you can see the follow-up, and this is the dimension and the emergence profile. I think it worked out very, very well because you have the height, you have the width, even if you place the implants in a delayed way. Because if you're now going to the events, if you say, okay, I'm doing delayed, like Linkevicius is saying, maybe it's a crime, not to go immediate, but it's not a reality sometimes, so this is very important, and I want to show you that even if you are not a fan of immediate, maybe it's too risky for you, in this situation you want to start, you can create perfect emergence profiles also if you do it in delayed or late implantation. So this is also a very important take-home message. Now I want to maybe end a little bit to the perfect white. As you can remember, here, if it's possible, we try to screw our crowns. But what is about this left picture? Yeah, of course, it's a nice veneering technique here. It looks good. But here I want to show you also a uh, very important take-home message. It's very, very important not to place veneering ceramic in the area around your emergence profile, because here you have a lot of adaptation of the biofilm. And then you can cause some mucositis and you can occur, of course, periimplantitis. So try to use here ultra polished zirconia in this area. And you can see here at the picture what I was faced with, if you can see it here. You always have to check and clean the crowns when you get it from your dental technician, to be sure, and not concentrate only, oh, my augmentation is so great, or the soft tissue is great, and then just place it, make some pictures, and it looks really, really nice. This is also very important. It's a simple thing, but you have to think about that. So this is the situation after the placing, and now I want to come to an end. And sum it up for you. If you treat perio patients, you always have to have it in your mind that you are always operating and do the surgeries at a higher risk level. You have to check about the opportunities, the risk, and also the limitations, of course. And you have to be honest with yourself and your own skills. I know it a couple of years ago. I did my postgraduate in Germany, and we are always looking forward for the courses by Professor Hürzler and Zur and doing some tunnel techniques and so. But do you really, is it the daily business? So I'm a general dentist as well. I have patients, they're coming with no appointments. I have to treat them. So it's good to have them, of course, yeah, and there is especially a place for them, yeah. But you have to be honest with yourself, yeah. So one motto in our practice is keep it simple. Life is too complicated anyway, laws, stuff problems, yeah. So I think maybe a very, very high technique is not very good for the daily business actually, yeah. So this is why we created our implant concept, especially for young colleagues, maybe to give it in a right way. You can't do it everything with that, yeah, but I think it's a good base, yeah, especially to start with implants, to start with augmentation, and then you can really show, okay, how to, I want to improve my own skills. So I want to thank you very much for your interest. And now I'm, of course, here for question and answer. You can also follow me here on Instagram and send me direct messages if you're interested. So thank you very much.